My name is Dr. Brian Gross. I work for LewisGale Physicians. I serve here as an otolaryngologist, head and neck surgeon. I've been here for about 3 years. Sinus disease is very common in the US, and it's very common in the Roanoke Valley. We have multiple different sinuses, the cheek sinuses, the maxillary sinuses, the frontal sinuses. We have sinuses in between our eyes called the ethmoid sinuses. And then sinuses that are basically in the middle of our skull called the sphenoid sinus. People can develop nasal congestion, runny nose, difficulty breathing through the nose. They can even patients can lose their sense of smell, and ultimately that means loss of sense of taste. And there have been lots of studies done on people with chronic sinus disease and have equated the effect of sinus disease on quality of life equivalent to things like heart failure and diabetes, and causes severe depression and loss of sleep. So it's a big deal. One thing that I do is the comprehensive evaluation of a patient with these symptoms. That often involves a history, physical exam, completely understanding all their other past medical conditions, their medications. And then a lot of these patients, we go on to provide medical therapy. A lot of them need imaging as well. We have special CT scans that we use to carefully evaluate the sinuses. And that helps in making decisions in terms of, does each patient need medical therapy, or are they going to need surgical therapy as well? So there's a lot of different medical therapies for sinus disease. In patients that are suffering from acute sinus disease, when they get a sinus infection, get a lot of nasal drainage, facial pressure and pain, the most common treatment is a short course of some antibiotics, sometimes some steroids, and then using saline in the nose. Sometimes though that problem becomes recurrent, to where patients are getting repeated episodes throughout their life. And sometimes it becomes so frequent that it dramatically affects their life. And then it means that we need to step the therapy up a notch. Other people will get sinus infections that just won't go away. So they pretty much have sinus problems all year long. And those patients as well will need medical therapy, and then often will need surgical therapy. When we make the decision with the patient to go on to surgical therapy, more often than not, it's not a cure. Surgery does not completely cure them. But in the majority of well-selected patients, they're going to see overall improvement quality of life and better control of their sinus disease. The surgeries that we do, we again make an individualized treatment plan for the patients. But there's treatments that we do both in the office and then in the operating room. In the operating room, I do what's called an image-guided endoscopic sinus surgery. It is done under a general anesthetic, and the surgery takes about 1.5 hours to 2 hours. There's no external incisions made, using tiny little cameras inside of the nose and opening up those natural passageways into the sinuses. When patients wake up, there's a little bit of pain, but most patients are not complaining of too much pain. We do give pain medications, antibiotics, and then patients are also using some sinus irrigations with saline. Patients go home the day of the surgery and are usually taking it easy for a few days. But within a week, most patients are up and going and doing their normal activities.